Thank you for joining us today on another installment of Frost & Sullivan's exciting podcast series highlighting key disruptive technologies, growth opportunities, economic trends, new business models, industry convergence, emerging geographies, and much more. We will now be listening to Reenita Das, Partner and Senior Vice President of Transformational Health Division at Frost & Sullivan, decode the digital revolution that's happening in the global healthcare sector at the 2019 Dubai Health Forum.
So what is the digital revolution in healthcare that we're talking about? Just some simple numbers that I came up with. We're close to 40 million people who are using smartphones today. There's 75% of consumers want to use some form of a digital technology for healthcare practices. Healthcare data is doubling every 24 months. So what you learn in the first year of medical school, by the third year, that data has doubled and as well as changed. If you look at chronic diseases like diabetes, cholesterol, high blood pressure, $47 trillion will be spent by the year 2025. That's a huge amount. We're seeing 20 to 30 billion connected devices in the world. And the biggest change that we see happening is that we've come to the conclusion that 55% of decisions are not focused on the body. They're focused on where you live. So your health eventually is your zip code, which is what we are calling the social and economic determinants of health. And yesterday I was reading that Kaiser Permanente, which is one of the largest health organizations in California where I live, has started investing in property. And they're starting to build real estate for homeless people because they feel that they're having a huge portion of their people visiting the emergency room are people who are homeless or who are having one chronic condition because of the loneliness that they're facing. So we have an HMO in the country building housing now, and that again goes back to the social and economic determinants of health. So obviously there's a huge need for efficient and high quality healthcare. So we have to reverse the debate. All of this time we were spending dollars and money in terms of an aging population. So just so that you have an idea, we're looking at some numbers which are huge here in the bar graph, 22 to 25% that are going to get to the age of 65. There are 10,000 seniors every single day in the United States. And in Japan, we're looking at 70,000. So that is a huge number in terms of cost that's going to escalate into the healthcare industry. So we have to look at changing the cost curve. Rather than focusing on people who are sick and end of life, we need to focus the dollars and spending on wellness, keeping people well. So we did an analysis within our group at Frost & Sullivan with projections of where we believe money is going to be spent in the future. So if you look at the bar graph, you'll be able to see that we looked at 3 spaces of time, and we looked at therapeutics, we looked at monitoring, we looked at prevention and diagnostics. And right now you can see in the light green, most of the money is being spent on drugs and devices. But in the future, more and more money is going to be invested in diagnostics, in monitoring, and eventually in prevention. So I always tell this to many of our companies that we work with, that if you're purely focused as a pharma company on drugs or a medical device company on devices, you really have to think beyond a drug or a device. The model today, the business model, is much more going beyond that to other areas in the ecosystem, which is prevention, wellness, and healthy living.
We hope you found this podcast insightful. Check out the space for more exciting updates on the future of health from Frost & Sullivan. To know more about our growth partnership services, email us at digital@frost.com. Thanks again for tuning in.